A new UNICEF report has revealed that South Africa is one of 20 countries that account for 65% of all children living in severe child food poverty globally. UNICEF South Africa representative Christine Muhigana joins us live now to unpack this. Good evening, Christine, and thank you very much for your time. What disturbing figures, more concerning, is that 23% of the children in South Africa are classified in that category. Just talk us through that child food poverty report and what it specifically looked at.
Good evening, and thank you for allowing us to come and share with you this very important information that we are sharing with the world. So the report is actually reflecting data from 100 countries around the world, and as you said, we have an alarming information that we need to deal with and address, whereby too many of our children, including here in South Africa, are living in what is called child food poverty. So the children who are food poor are children who are not receiving enough of the groups of nutritious food that they should be receiving. They should be receiving more than 8 such different types of foods, and if they receive less than 4 or 5 or 2, they're categorized either as moderately food poor or severely food poor, or in severe food poverty.
Mm-hmm. Now, what factors are fueling this child food crisis?
So a number of factors, but mainly 3. Poverty in a given family, in a given community. So people would not be able to afford, the types of food that children should get, particularly in their early ages. There are also practices, behaviors. Sometimes, we don't know what's best for our children, what kind of foods, nutritious food, what kind of healthy food our children should get, and there is also health-related issues that are there in terms of immunity, for example, that make some of our children unfortunately vulnerable to food intake.
When you speak of those health challenges, one even assumes from your malnutrition to just how their brain development would be significantly impacted in this case.
Absolutely, and the earlier these kinds of things happen, the less chances you have to actually address them. So we need to make sure that children, and particularly those that are reflected in this report, so under 5 children, get the right nutrition, the right food intake, the right healthy foods that they need to develop fully, be it physically or cognitively. And I should have mentioned that one other very important factor that fuels, the malnutrition of our children is the food system, the food environment, whereby, for example, and this is something that we also have in South Africa, food that are highly processed, to which sugar has been added, are actually aggressively marketed to communities, to families, to children, and that also fuels the type of food poverty that we.
Now that we've touched again on that, I wonder how much of an impact COVID has had on these figures, as well as the rising cost of living due to a myriad of issues, from conflict around the globe to the climate crisis, which one assumes was also pushing food prices.
Absolutely. So, I mean, the COVID-19 pandemic had an impact on a number of things that impact our children. It did exacerbate the situation of malnutrition because it did deteriorate, those factors that I was talking about, the fact that, families are poor. We know that, during the COVID-19 pandemic, during the confinement and the lockdown measures, people did not have access to the livelihoods that they would otherwise have had access to. So COVID-19 did exacerbate those factors, but then as we try to recover from the impact, whether economic or otherwise, of the pandemic, we have other things that come and hit us all. Be them conflict, as you were saying, be them the increasing food prices, climate. We see what's happening now in KZN and heart-wrenching situations whereby the water that families would normally use to prepare food is impacted during floods. They have to leave their homes. They're not in their normal environment anymore. They're in shelters.
The soil is compromised for subsistence farming. So it's quite a lot, honestly.
Absolutely. So what we want to say is that as a community, as actors, as development actors, humanitarian actors, we need to act. We need to act now. These children deserve to receive the diverse, the healthy, and in terms of also quantity, the intake that they need, so that they can develop fully and they can have cognitive development that will allow them in their adulthood to be productive and healthy members of our community.
And I take it this is not just a call to NPOs, but also ordinary citizens to help where they can. Thank you very much, Christine, for your time. That's UNICEF's South Africa representative, Christine Muhigana.